Choice of surgical aortic valve replacement versus transcutaneous aortic valve implantation for patients for whom a bioprosthetic aortic valve replacement is appropriate. Symptomatic patients, 4 indications. 1. For symptomatic patients with severe aortic stenosis who are 65 to 80 years of age and have no anatomic contraindication to transfemoral transcutaneous aortic valve implantation, either surgical aortic valve replacement or transfemoral transcutaneous aortic valve implantation is recommended after shared decision-making about the balance between expected patient longevity and valve durability. Level 1. 2. For symptomatic patients with severe aortic stenosis who are greater than 80 years of age or for younger patients with a life expectancy 10 years and no anatomic contraindication to transcutaneous aortic valve implantation, transcutaneous aortic valve is recommended in preference to surgical aortic valve replacement. Level 1. 3. For symptomatic patients of any age with severe aortic stenosis and a high or prohibitive surgical risk, transcutaneous aortic valve implantation is recommended if predicted post-transcutaneous aortic valve implantation survival is greater than 12 months with an acceptable quality of life. Level 1. 4. For symptomatic patients with severe aortic stenosis for whom predicted post-transcutaneous aortic valve implantation or post-surgical aortic valve replacement survival is 12 months or for whom minimal improvement in quality of life is expected, palliative care is recommended after shared decision-making, including discussion of patient preferences and values. Level 1. Asymptomatic, 2 indications. 1. In asymptomatic patients with severe aortic stenosis and an LVEF 50% who are less than or equal to 80 years of age and have no anatomic contraindication to transfemoral transcutaneous aortic valve implantation, the decision between transcutaneous aortic valve implantation and surgical aortic valve replacement should follow the same recommendations as for symptomatic patients in recommendations. Level 1. 2. For asymptomatic patients with severe aortic stenosis and an abnormal exercise test, very severe aortic stenosis, rapid progression, or an elevated BNP, surgical aortic valve replacement is recommended in preference to transcutaneous aortic valve implantation. Level 1. Both symptomatic and asymptomatic patients. 3. For symptomatic and asymptomatic patients with severe aortic stenosis and any indication for aortic valve replacement who are 20 years, surgical aortic valve replacement is recommended. Level 1. 4. For patients with an indication for aortic valve replacement for whom a bioprosthetic valve is preferred but valve or vascular anatomy or other factors are not suitable for transfemoral to transcutaneous aortic valve implantation, surgical aortic valve replacement is recommended. Level 1. 5. In critically ill patients with severe aortic stenosis, percutaneous aortic balloon dilation may be considered as a bridge to transcutaneous aortic valve implantation or surgical aortic valve replacement. Level 2B. Recommendations for choice of mechanical versus bioprosthetic aortic valve replacement. 1. In patients with an indication for aortic valve replacement, the choice of prosthetic valve should be based on a shared decision-making process that accounts for the patient's values and preferences and includes discussion of the indications for and risks of anticoagulant therapy and the potential need for and risks associated with valve re-intervention. Level 1. 2. For patients of any age requiring aortic valve replacement for whom vitamin K antagonist anticoagulant therapy is contraindicated, cannot be managed appropriately, or is not desired, a bioprosthetic aortic valve replacement is recommended. Level 1. 3. For patients 50 years of age who do not have a contraindication to anticoagulation and require aortic valve replacement, it is reasonable to choose a mechanical aortic prosthesis over a bioprosthetic valve. Level 2A. 4. For patients 50 to 65 years of age who require aortic valve replacement and who do not have a contraindication to anticoagulation, it is reasonable to individualize the choice of either a mechanical or bioprosthetic AVR with consideration of individual patient factors and after informed shared decision-making. Level 2A. 5. In patients greater than 65 years of age who require aortic valve replacement, it is reasonable to choose a bioprosthesis over a mechanical valve. Level 2A. 6. In patients 50 years of age who prefer a bioprosthetic aortic valve replacement and have appropriate anatomy, replacement of the aortic valve by a pulmonic autograft, the Ross procedure, may be considered at a comprehensive valve center, level 2B.